us every Wednesday on the QFM Facebook page, you will be able to see the large group. It's a contingent of 10. And so if you're looking, if you want to not just listen, but actually look at us live in studio, you can do so on the QFM Facebook page. Again, good morning to you. You may be on a bus at this time, getting into town. Good morning. You may be on that sea. It's been quite windy the past days, and so we want you to be cautious. But you might be trying to get some well needed fish for us. Good morning to you, all the fisher folks. You may be on the farm right now, ensuring that our food security is maintained. Good morning to you as well. And if you're in the office and you might be stealing a little chance to listen to us, don't let the boss get mad, but we are always happy to have you tune on to us every Wednesday as we bring to you the most relevant, informative health education that you deserve. This morning, our episode is brought to you by Wisdom. A healthy mouth begins with a hearty smile. I don't think none of you want to be blocking your mouth when you get a good joke. And so you can trust the Wisdom brand of all dental products for all of your dental needs, even at this time. So you might be looking for a toothbrush, that mouthwash, that floss, whatever it is, choose the Wisdom brand brought to you by that particular brand that is manufactured in England. Just in terms of upcoming events, I know that many of you have been asking already, when is the National 5K run? Last year was a big hit. Last year we ran against, I like to say not for, but rather we ran against lupus, um, kidney failure, and stroke. These were the three that we ran against last year. And this year, we are all going to be running against diabetes and sickle cell anemia. And so we will be giving you the dates very soon. It is going to be in the month of preferably April. We will be having the 5K run. We know that April is around Easter. The weather is generally very sunny and dry, and so we choose that time frame as the ideal time for the national 5K run. So start spreading the word. As usual, it is going to be on donation. Generally, the corporate community, they support this amazing initiative, and all of the monies that is collected will be distributed to these NGOs. Again, we will be having branded shirts and color coded shirts. So if you're running for sickle cell anemia, you'll be wearing a particular color. If you're running against diabetes, you'll be wearing a particular color. We ask people to choose which disease they want to support. Some people support the two. Some people support the one of choice. And oftentimes, two people run in memory of someone that may have succumbed to that particular disease. And so we are admonishing you, if you're listening and you missed last year, we certainly don't want you to miss this year's National 5K run. Again, the run always begins at the Massa Kinfield Government School, and we end at the Lindo Park in Goodwill. So it takes us just a little over 5K. We've always said to people, if you can't run, you can walk, you can jog, you can cycle, whatever. Once you are moving and you are moving for the cause, that's all we expect. And so I expect my producer, who looks quite fit, to be running along with us, and maybe Matt Peltier. I know Carly John Baptist always runs with us, but I'm hoping to see Matt Peltier in the ring running with us in April for our national 5K run. This morning we have a very large team. As I did mention, it's a contingent of 10, and they are from the state of Iowa. Many of us, including myself, have not been to that side of the US. Most of us, as natives of Dominica, most of our families are in New York or Boston or Atlanta or Florida, more or less in the south of the US. But in the Middle East, the Mid East, you call it?
Midwest.
Midwest,
Yeah.
right? Not many of us maybe go to that side of the US. And they showed me photos yesterday, and trust me, I am loving paradise because it is blanket white,
Yeah.
snowing like hell.
Mhm.
Although they said
That's
hell
real.
is hot,
That's real.
but I suspect it has a pinch of snow right now.
Uh-huh.
And they are so happy. They have been basking in our wonderful sunshine. Last night they said to me they went up Callion, up that hill because they are at Jungle Bay, and they are with us this morning, headed by no stranger to Dominica. Every year this lady is here. I believe that she deserves an honorary passport. I think she
Love
might
this.
make she might be one of the people that should get a diplomatic passport. I think she will
Aw.
really promote Dominica well, knowing that she got married right here at the White River. You know, she really promoted our nature isle, and from
2007.
2007, since that time she's been here, and she's been coming over and over, and every time she comes, she brings new friends to us. So guess what? Maybe Zach and Zach, not mean that they're together, but we have two Zachs in the groups. They might bring their fiancés and get married at one of those locations.
I mean, I would do some wedding planning if
Right.
they need and
Right.
sponsor some
So
cakes.
so yeah, so they might do so. But we have this group with us today. What we're going to do, we're going to take a short break, and then I will introduce the team leader and the topic for today. Let's take a break, and we'll be right back with you on your favorite health show, Health Vibes. Stay tuned.
Jolly's Pharmacy is proving you otherwise with Health Vibes every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor, and not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Depot and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
I woke up this morning feeling real stink. I had big pictures to call it sick, but I end up in Jolly's Pharmacy. And down in the street, I listen some my immune system. Got me feeling fit and strong, now I'm ready to work and take on any mission. If you see me walking, Jolly's Pharmacy is number one, Jolly's walking. We cater for everyone, Jolly's walking. Boost up the immune system, Jolly's walking. Yo, Dominic is the white water box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor, and not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Depot and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Definitely leading the way in healthcare. This morning, again, we're happy to have you on Health Vibes. Let me say good morning to Trudy Christian and Jacinta Fagan Difu, my two co hostesses who won't be in today. with us. Let me say a special good morning to all the viewers and listeners on air and as well virtually. I'm saying that we have 14 people viewing right now, and 3 people have picked us up already. Good morning, good morning, good morning to you, and we're happy. So, as I said, we have a large group from the University of Iowa, based in the US, and they are students who are completing their doctorate in the field of pharmacy. And you recognize that pharmacy is indeed one of the preferred medical professions, and we are happy to have them here with us. We have with us the team leader, Dr. Janine Ambrose, and she is one of the professors at that university, more specifically the pharmacy department, and she is primarily responsible for international medicine. And so every year she brings students from her class to Dominica to learn about different aspects of medicine and medical administration, and even learning about the culture and how culture influences people's ideology and the perception of medications. And so this morning, let me make welcome, and I will call her the dame of the group,
Aw.
Dame Janine Ambrose. Dr. Janine Ambrose, good morning to you again. It's just last year, just around a few months ago, you
know,
were here.
it goes by so
It goes
fast.
by so quickly.
And I was here in September. I was doing some CPR or basic life support trainings.
Yes.
And I got to go back to Delise and La Plaine. So I shout out to that community just to say hey, and working with Dr. Cassandra Williams. So I always really look forward to that. And Jolly's, I mean, Carlton, we've been friends for
Quite some time.
we're both very only 27 and a half. If you ask my kids, they say that math isn't working out now, but we've been friends for a long time. I am so grateful that we've gotten to work with Jungle Bay and we've gotten to work with Jollies. I feel like it's our extended family. And I was giving my kids a hard time this morning. I gave them a hard time before they came. I was like, if you don't behave, you can't come this year. And they were like, I want to see my family.
Yeah.
And it really is. It's our family. And we're here. And this is our second home. I also want to go around and introduce these amazing students and also the preceptors that I have with me, because we were just talking this morning. These students started with me. I get to teach the first class that they have when they're in pharmacy school, and they started in COVID. And boy, was it a weird time for their class. We had like not being able to sit together and spread out. So I'm really glad that we're making these bonds in this relationship. For everybody in Dominica that's listening to us, I can't begin to thank you enough for how much you welcome us each year and make us feel a part of your community. We're just so blessed to be here and to be there. And Carlton's not lying. There is like feet of snow. School is canceled. People are stuck places. So it's even a better time to be here right now. So I'm going to let each of the students introduce themselves and our fabulous preceptors. For the preceptors, if you want to talk about how many times you've been here too, I think I'm on my 23rd for times of being here, then we'll share a little bit about themselves real quick.
Hi, everyone. My name is Sydney Ross. I am a fourth year Doctor of Pharmacy student at the University of Iowa. I am from Iowa originally, so very much not upset that I'm missing out on the snow right now, but so happy to be here in Dominica, and you guys have been lovely in welcoming us, so we're excited to be here.
And hi, everyone. My name is Fabiola. I am also on my fourth year of my doctorates in pharmacy school, and I'm also really excited to be here, and it's just been wonderful so far.
But Fabiola, you're from the Caribbean.
Oh, yes. I am from Puerto Rico, so I'm
Awesome.
originally from the Caribbean, so it's just like very similar, and it feels like being home.
Yes.
And I appreciate how much she's sharing of her own culture. And, you know, I think that aids in our discussions and contributions.
Very, very good.
Hello, everyone. I'm Zach Nunemaker. I'm also a currently a fourth-year pharmacy student, originally from Iowa as well, a small town. It's been a blessing to be here. It's such a beautiful area, and thank you for welcoming us.
Good morning, everyone. My name is Alyssa Conaway. Like a lot of my other fellow classmates, I'm also from Iowa, so not at all sad that I am missing some of the snow, but I'm really excited to be here and learn from all of you, so thank you.
Hi, everyone. I'm Sarah Carr. I'm also a fourth-year pharmacy student. I'm from Illinois, which is right next door to Iowa, so also a lot of snow. Very happy to be here, and it's been great so far.
My name is Zach Lands. Again, I'm a fourth-year pharmacy student, also from Iowa. It's just been amazing to be here, see the beautiful scenes, and learn more about your amazing culture.
And before the preceptors go, Carlton, I'm going to say one of the Zachs is single. We won't tell you which one. And also, the girls could get married here. And also, Carlton, you have an open invitation to come to the University of Iowa College of Pharmacy. We have a medicinal herb garden to go in with our topic today. And you're always welcome to come hang out and see us.
Thank you.
So hi, everybody in Dominica. I want to thank you for always welcoming me. I'm Jane Boyd. I'm a practicing pharmacist in the state of New York and an adjunct professor at the University of Iowa. This is probably my 12th time being here. I started coming in 2013, and every time my family, Dominican family, continues to expand, and you guys welcome me so well. So thank you for all of that.
Thank you.
Good morning. My name is Ashley Wallace-Lacey. I'm also a pharmacist. This is actually my second time here. I was here in 2019 as a fourth-year pharmacy student with Dr. Abrams, so it's so good to be back. I currently live in St. Louis, Missouri, and I am a data analytics pharmacist working at the Veterans Health Administration, so supporting our military veterans after they've come out of service.
Awesome. Great.
Carlton, it's so fun to talk about this. And for those of you, if you're thinking about a career in pharmacy, if you have any little ones, we always take international applications. And also, I think Ashley and all these students give a great example of all the things you can be.
Definitely. So what we're going to do, we're going to really get into the topic of today because of time. This morning, we want to talk a little about, it's an area that will invoke a lot of interest. It's one that many of us culturally are aware of and are often passionate about. And we're talking about the role of herbal medicine in human health and wellness and some of the precautions to be taken before using them. So most of us in Dominica, we would have grown up, especially those of us who were born in the early 70s, like myself, you would have known of, not necessarily the Ovaltine or the Milo or the chocolate tea, but you would have known of your kaku, as we would call it, or cocoa tea, or your mother just go in and pick some leaves outside of the lime tree or some other tree, Simei-Kotwa, whatever it is, and make your bush tea for you. Whether it's in the morning, whether it's in the evening, you were given that. You have a bad stomach, you have diarrhea, you would be given young gobble leaves. You get your bay leaf tea, you get your cinnamon tea, and most of us grew up with these. Up to now, these herbs are still very, very relevant. This morning, we want to focus a little about not just their relevance, but some of the precautions and concerns that we would want to highlight before some of these herbs are used. Some of them may be good for you, some of them may not be good for you based on underlying medical conditions that you may have. So, Dr. Ambrose, herbal medicine, is it something that you are also seeing very prevalent in America? Because even in Dominica, in most of the pharmacies, we're seeing many herbal supplements that are packaged in capsules, in tinctures, in liquids, in tonics, in gels, in all different types of preparations. Herbal products are being marketed and being purported to help to heal and to cure XYZ. Is it something that is quite common in the US as well?
Absolutely. I mean, I think in my growing up, we even had things that our grandparents or people would prepare for us, and not just herbal therapies, but other therapies too. So I remember, like, I have a lot of allergies and different things like that. My grandma always having a pot of hot water, salt water to kind of, clear your sinuses and help you out too. But in the States, it's actually something that I don't think a lot of people know, that most drugs, up until a certain point in history, where we had some different newer technologies, but even still now, most drugs come from plants and come from studying traditional therapies. So, we were kind of making a list, and we thought about senna for, kind of your stomach or your regularity. Cancer therapies, I know you and I were talking about, they come from tree barks, which that kind of blew my mind. I
Yeah.
didn't think of that as, like, cancer therapy seems like, okay, more severe condition.
Yes.
I was saying I went and got my second degree in Wisconsin, and actually one of the buildings is the Wharf building, and it is paid for by warfarin, the blood thinner. And they discovered it because cows were eating sweet clover and they were having a lot of bleeds. So they decided, hey, there must be something to this. Let's
Yes.
study it more. And then we said, digitalis for your heart, aspirin, morphine, codeine from the poppy. We even talked about, like, amoxicillin and some of the antibiotics from studying mold. So it comes from somewhere, right? And it's just that nature has all of these other variables that are a part of it, or the plants have all these other variables that are a part of it, that we just have to be familiar with that consideration so that we're helping people to use it safely. And Sydney, I'm going to ask you to kind of share, with the group, because we're talking about herbals, but we're also talking about integrative therapy. So I'm going to ask Sydney, you first, to kind of, share with us, like, what are we talking about when we're saying herbal therapies?
Sure. So there are a lot of different places that these herbals can come from, actually, whether it be, going outside and picking some leaves, digging up a plant and using its roots, or just taking a flower or tree bark and really grinding that down and putting it into a tincture or a tea or some kind of capsules. They come from a lot of different areas, and really making sure that you're exploring all these different areas. Obviously, we see them more in the casual settings, whether it be at home or coming from a parent or a grandparent that's taking care of a sick child. But we can also see these in the pharmacy. So as you're walking down the aisle in Jolly's Pharmacy, you will see a lot of different herbals and supplements that you may recognize some, you may not recognize others, but all of these have very different uses and very different purposes. And one of our focuses today during our radio show really will be to make sure that we're explaining these differences to you, making sure that we're aware of not only what the drug can do for you, but potentially how it could harm you, as well as what other drug interactions it could have with other medications you're taking or with other disease states that you're having. So it's really important to be aware of all of these things. And it's really important to also consider that these herbals and these supplements can either be all of the health regimen that a patient is on, or it can just be part of that. So it's really important to communicate those things with your doctor and stay really open and honest about those things.
And that's a good point that you've raised, because I have seen it in the years of being a pharmacist, where people have sort of hidden or they've hid the fact that they're taking a supplement, and sometimes the doctor recognizes, well, your situation or condition is not being normalized, and so they increase the dose, so they may change the medication, and maybe because there is something in the herbal medicine that is potentially causing an elevation in something else. Even with blood tests, sometimes the doctor may recommend a blood test, but you're using an integrative medicine or a herb, and that herb might also some way prejudice the results of the test. So it's a very interesting conversation. Yes, we promote herbal medicines like we would do with synthetic medicines, but there are many things that goes beyond the scene, because they are metabolized very much similar to that of synthetic drugs like paracetamol or Tylenol or something like that. And these vital organs, whether it's the kidneys, the liver, the GI tract, they are also very much involved in breaking down these herbs too.
Yeah. So, Zach, can you kind of share with us what integrative healing is? Because we've kind of dropped that term. And I think, you know, Sydney kind of started touching on it, but to think about what are we meaning when we say that?
Yeah, of course. Integrative healing or integrative medicine is becoming a more and more popular healthcare approach. It's utilized more and more today. And what it basically is it's combining a combination of therapies and like lifestyle changes to treat and heal the whole body or the whole person. And what I mean by the whole person is their spiritual, body, emotional, and mental wellness and health. So, for example, like some lifestyle changes that we'd like to include would be like, you know, running for the 5K or, you know, diet and exercise. You want to get the 30 minutes of running in each day, 150 minutes per week is recommended. We like to use a combination of approaches to treat the whole body. And what I mean by that is emotional, mental, and wellness.
But Zach, as you're on, because over the years we've had this, I call, false sense of false perception that conventional medicine has always looked down on herbal medicine or herbal practitioners. As a pharmacy student that's almost complete to be a pharmacist, have you seen the gap, or have you seen that as mere a perception, or maybe because people just don't understand, oh, that's false?
Like, is it getting where we're knowing it more and we're
because you would have
Yeah.
done, because even in,
Yeah.
in your studies now as a pharmacist, you have to do a course in
Yeah.
herbal medicine, right?
Mhm. Yeah, as pharmacists, I think we want to, you know, treat the whole person and, you know, provide them care that's, you know, treating everything, not just like the condition that's going on in the person, like the organ or the body part that's experiencing some difficulty. We want to provide a overall comprehensive approach, and I think that's becoming more and more popular as pharmacists today, that we really key in on in our practice.
You can tell them about Town Crest as an example, like just having, or Fabi, you can kind of share that.
Yeah, just to speak a little bit more about what Zach was talking about, I feel like the practice is bridging that gap between synthetic medications and herbal medications, and seeing how they can both coincide in the medical field, and just sometimes having that conversation with the pharmacist and with that is a specialist of medications, and just to share my experience, a pharmacist back home would focus only on also treating just that wellness and implementing just other herbal medication that can also benefit the patient if they were willing to have that option or felt more comfortable with that option, which is also important.
Yeah,
thing to
so
know.
there's specialty pharmacies that are opening up that are just focusing on whole person care or herbal therapies, supplements, and use, recognizing that that's a very specific area. And there's also doctors' offices that are opening up that you know, are integrative healing places where they'll more readily recommend things like acupuncture or herbs or different things to kind of help you be well. And also thinking about the cultural aspects. So I know I've told Carlton I do mobile clinics,
Yes.
and we work with a lot of different patient populations, different refugee populations as well. And in the times that we haven't thought about culture and language, our interventions, our things that we're doing for our patients haven't been as successful. And so we really had to pause, go back, and work closely with community leaders and people to say, what are you willing to do? What do you believe? Why is this important to you? To really understand people's motivations. Because, you know, if you're not motivated, you're not going to do it, right? You're
That's
just
true.
going to kind of ignore it. You might say, yeah, okay, that's the Iowa version of, yeah, I'm going to do that, but I'm really not. And then you're going to do whatever you're going to do or you believe is going to work for you. So we need that, like, yes, I agree to this. I feel good about it. You know, I feel good about it. I trust you because you're not judging me for my decisions, and kind of approach it in that way.
Definitely. Um, I wanted to touch though a little on um, yes, the herbal medicines are useful. They are around us. Many of us um, inadvertently may just use them as frequently as possible, or sometimes we boil the leaves or we draw the leaves and we decide, we're going to do a cooling, as it is called, like a cleansing of the system. Um, are there some precautions that should be taken? And are there specific groups of people that may be at risk for adverse effects? So, for example, a child below the age of 12, a parent come in and say, "Well, I would like to clean out my child because I feel that my child's blood is dirty." Sometimes they give you these types of statements, or they make these statements. And even when you say, "Well, listen, the child doesn't need any blood purifier. The child may just need to be dewormed, give a supplement of multivitamins, a tonic, and ensure that the child has a good diet and so forth." Sometimes the people are still not convinced that this is the way to go. They may still say, "Okay, you don't want to give it to me. I'm still going to take it on the shelf and I'm going to give it to the child." So let's talk a little about some of the risk factors and some of the groups of people or demographics that should be very cautious when using a herbal supplements.
Yeah, I think that's a great question. And I think it's important to remember that some people might think that natural always means safe, and that's not the case. And also, what's safe for me might not be safe for other people. So, some special groups to consider would be younger children or babies or infants. They might not be able to handle the same dose, or they might not be able to clear the medication in the same way that older adults can. And then also just older people that are older in general, they have more risks, more chronic conditions possibly. So some chronic conditions, if your liver's not working, if your kidney's not working, we really rely on those to clear medication out of our body. So if you have those conditions, it might not be safe to take some of the herbal medications. I think that's important to remember, to just have that conversation with your pharmacist, with your provider about what conditions you have, and they can help you out. Some other things to consider is drug interactions. So the natural medications, they can interact with other medications we're taking. So especially blood thinners are a really important one. We don't want to take an herbal medication that might interact with your blood thinner, which can maybe cause an increased risk of bleeding, or it could also cause an increased risk of clotting. So just discussing that with your pharmacist. And as a pharmacist, we should be asking those questions to help identify those conditions from our patients. Oh, yeah. And pregnancy and lactation is another very important one, because the medications can cross from the mother to the baby, either while the baby is in the womb, or with breastfeeding. The medications can also cross into the milk and get delivered to the baby. Since those medications might not be safe for the baby, we really want to consider that.
Definitely. And again, I do hope that you would have listened. We talk about age. We talk about underlying medical conditions. We spoke about pregnancy. We spoke about the elderly. We spoke about babies, because babies, their organs are not developed to detoxify or to metabolize or to break down concentrations of drugs. And so hence the reason why, if you're pregnant, if you're lactating or you're breastfeeding, yes, your grandmother or your mother may suggest that you drink X, Y, and Z, but you want to be very, very cautious. Even people who are pregnant, sometimes somebody will recommend to drink this particular bush so that you will have a safe delivery, or from a cultural standpoint, they might say they don't want anybody to harm the process of delivery. Somebody can do a spell on you, that kind of a thing. And so if you drink this particular bush, then it will prevent any complication. But even with these types of decisions, it is important that you speak to your medical doctor or pharmacist regarding the use of some of these herbal medications.
Well, and Carlton, I know you you at Jolly's always have certain brands that you trust
Mhm.
too. So some products might not have in them what they say they have in them. There's some things that aren't regulated, and so it's important that you work with the pharmacist to know a good brand, or to know if you bought in something from somebody that it really has in it what it says it has in it.
And that's a good point too, because we're talking about dosage forms. Many times you take one leaf or two leaf, and you really don't know the concentration of that particular active ingredient, what we call the herb, in there, and you may find yourself overdosing or even underdosing, or you may find yourself being exposed to other inert active ingredients that can potentially harm key organs, or even cause you to end up having an adverse reaction. So we're not saying this to scare you, because we've all advocated for the integration of medicine, where herbal medicines do have a place and have a key function. But at the same time, too, we want you to be aware that the very same way that you'll be concerned about the paracetamol or the aspirin or the ibuprofen, the very same concern should be meted against one of the herbal preparations that you may be using. Let me just give you the numbers, just in case you may want to call and interact with us, and you may want to share your own experiences, or you may want to ask a question. Feel free to do so. The numbers are 4493095, 4493096, 4493097, 6164257. And of course, you're always welcome to connect with us if you reside outside of Dominica. That number is 305 432 9624. Let me take that number again, 305 432 9624. That's the overseas number. So if you feel that you need to ask a question, you might be on a herbal supplement at the moment, you may want to ask one of the pharmacy students about it. You may want to ask one of the professors about it. You may want to ask myself, and the lines are already going. We will take your questions, and we will try our best to answer. Good morning to you, caller. Thank you for calling.
Hello, good morning. Well, a question I want to ask: the tisane that Jolly's has, how do you take it? Do you have to take the whole bottle or some from it?
All right. So you're talking about the Tisane blood purifier, and that contains at least 4 herbal preparations. I know Sana is in there. I know Bodok is in there. I know that it has aloe and some other active ingredients. Now, for blood purifiers, or what we talk about, many of the active ingredients in this formula work on the gastrointestinal system. So it's going to actually help to rid excess waste from your colon. It's going to help to, some of them do help to eliminate parasites as well there. And by so doing, your whole circulatory system, your entire system would be better. In terms of how long you should use this, we normally recommend not more than 5 consecutive days. And it depends as well on whether you are having diarrhea, because not everybody gets diarrhea with it. Because if you're getting diarrhea, then we have to be cautious about dehydration and the loss of key electrolytes, potassium, glucose, and sodium. And if you lose too much electrolyte, then your body can get into shock. And we don't want that to happen. So you want to be mindful. If you're experiencing profuse diarrhea, then you should not use that product for not more than 2 days for sure. But if you're not having any diarrhea or other major adverse effects, then you can use it for up to 5 days. We normally recommend that the dose is in the evening at bedtime. But it's a product that is quite popular. Many people have used it for many, many years, and it still has its relevance. I wanted to ask, though, in reference to herbal medicines and dental care, because I remembered a couple of years ago, someone succumbed to a post-surgical procedure that was done, and the patient end up dying of profuse bleeding,
Mhm.
where the bleeding they could not arrest the bleeding, and the patient died from what we were told. A lot of the times, too, people are using over-the-counter medicines. They might be using taking herbal teas, and they have to go to the dentist for an extraction, or they may have to go for a cleaning, or they may have to go for a root canal or something like that. And the dentist may ask, "Are you on medications?" And they may just think of immediately a synthetic drug and say, "Well, no, I'm not on the medication." They're given the form, and immediately they tick out no, but they're not conscientious of the herbal supplements or the herbal tea that they may have drunk in the morning, maybe even a mere 30 minutes or an hour prior to the procedure. Um, Tell us a little about some of the precautions that should be taken and what should be told to the dentist or dental hygienist regarding what you would have taken.
Yeah, of course. So I think that goes back to the open communication that we have been kind of talking about this whole time. A lot of times when we ask our patients what they're taking, all they think about is those synthetic medications. And we really do want to think about those herbals as well, because they do have effects. So we've been talking about those blood thinners a lot, and there are medications that can cause blood thinning as well as those herbal products. So if patients are taking one or even both of them, that can cause a problem when they go to the dentist. So just having that open communication with your pharmacist, with your dentist, to let them know there are precautions that we can take if we think patients are going to be maybe more prone to bleeding. Maybe the dentist would take a different approach. So I think that's something that we can work on from both sides, both patients trying to be more forthcoming and remember to say those things, but as well as healthcare providers trying to ask our patients specifically about those things, not just asking what medications are you taking, but also trying to specify, okay, are you taking anything over the counter? Are you taking any herbal supplements, to try to kind of draw that out from our patients?
And that would apply to even invasive surgeries as well. In the hospitals, a patient may go for whether an invasive surgery and may not be aware that the herbal supplements could also be one of the potential risks involved in bleeding.
Absolutely. Yeah, that is also true. So, and there's things that we can do as healthcare providers to check that. We can check labs, we can give them medications to try and reverse some of that bleeding if we see it, but we have to know that it's there. So, the amount that patients are taking, the frequency that they're taking these herbals is really important information for us to have. So I think just keeping that open communication is really key in these situations to try and avoid some of those bad outcomes like what you were talking about.
Right. So let me play devil's advocate. So, for example, a person could have been home and experiencing dental pain, right? And all they had in the house was aspirin. Okay, and so they took maybe 2 doses or 3 doses of 625 milligrams of aspirin, and then they go to the health center, and the dental hygienist or the dentist checks them and asks them, have you taken anything for the pain? And then the dentist, they say, well, I've taken aspirin. And the dentist say, well, unfortunately, we won't be able to do any type of surgical procedure on you, like an extraction, because the aspirin can thin your blood profusely and cause you to bleed a lot. But there are some herbal supplements too, like ginkgo biloba, turmeric, that's what I wanted to say. Turmeric, ginger, as well, can also thin the blood. And so these are like turmeric is very, very popular. Cayenne pepper
Anti-inflammatory.
is they're anti-inflammatory agents, but they also are blood thinners as well. And so you might have drunk maybe, 2 cups of teas of either of these, and subsequently didn't say to the doctor. You just say to the doctor, yes, I had breakfast. But what? So maybe these types of questions should be asked as well by healthcare providers. Let's see what this caller says to us. Good morning to you, caller. Thanks for calling. Good morning, caller. All right. Good morning. We seem to have lost you. Again, the numbers are 449-3095, 449-3096, 449-3097, 616-4257. And we do have a caller right now. Let's take this caller. Good morning to you, caller. Thanks for calling.
Yes, Carlton. Good morning. How you doing?
I am doing well, and you?
I'm good. I'm good. And to you and your guests, good
Yes.
morning.
Good morning, sir.
Yes, I have a question and a comment I'd like to make. What is your mission on Dominica as far as your research? Is it just a
Yeah. So we have a couple of missions. One is I think it's important for people to understand about health systems around the world, because there are good and bad things to each health system, things that we really like, but appreciating how people approach health in different places of the world helps us to be better practitioners, and helps us to be more understanding. So by working with Jollies, by working with the Ministry of Health, by talking to patients, we do some health screenings with Jungle Bay for their employees, for the community. Not only are we giving something, we're giving our knowledge, but we're also receiving a lot. And that's really important to us, that this is a partnership, this is a collaboration. There's mutual benefit. Tonight, we're going to have a continuing education with Carlton as well, and with a lot of the healthcare team. And then next week is really focused on herbal and natural medicine, because one thing I want you to appreciate is that this is a part of cultural heritage, right? And there are experts that are in Dominica and exist that know things about these plants that exceed our knowledge for different components, right? We're good at looking up drug interactions. We can tell you what some of the resources do, but some of that cultural knowledge gets lost of, like, why did your grandma get that particular herb and that particular conversation? So this is really something that we need to preserve. And we're really excited to have those conversations of, like, again, how we work together to do that, to make sure that generations from now, you're still able to say, my grandma gave me this formulation for this reason, and this is what she gave me. As opposed to, I think my grandparents have passed, right? So there's all these questions that I would have loved to ask now that I know that you can't go back in time, you can't write that down, you can't preserve it. So we hope to be involved with that.
Can I say my last piece before?
Absolutely. Yeah.
Yes. I really responded kindly to your answer. That's a good mission. So
thank you.
This was one of the main things I wanted to know. What is the ultimate goal? Now, a second one is, now that you answered the mission, I'm going to tie something to the mission.
Okay.
The green zone. I mean, not the green zone, the blue zone.
Yeah.
Are you aware of this kind of project and study that has been done globally?
Tell me, just so I make sure I'm knowing the right thing that you're referencing.
Okay, the blue zone is a study where people are studying parts of the world where people live to be a century and more.
Yes.
And it seems to be
okay.
But it seems to be not just that these people are lucky to live that long, but it has to do with, I guess, during the study, the lifestyle of the people, the environment, and the kind of way the entire life, the holistic
yes
of the society. And I would say at one point, Dominica is considered, or should be, it was one time considered as a blue zone. Singapore, you have Japan, you have some place in Eastern Europe, I don't remember the name, but there are countries around the world where that is considered because of the lifestyle. So
absolutely.
I wanted to say to you and to Carlton, because Carlton did a show one time where he had colors called to give in natural medicine. And what you are just saying lines up with what he did a few years ago.
100%.
And to record it and to analyze what worked and what don't, because we're in a struggle today to maintain natural healing.
Yes.
Because the pharmaceutical companies, the big pharmaceutical companies want to take over these things and kick the small man out of the business. And these things are becoming an issue. That's why it has been legislated in the United States.
Yes.
So I'm listening to yours.
So there's a couple of things that we teach. And I know Ashley as well is really passionate about this. So we talk about the United Nations Global Sustainability Goals. And those goals look at how everything in life is interconnected. So it looks at access to food, it looks at education, it looks at life on land, life in the water. Everything is tied together to be healthy or well. And then we also talk a lot about social determinants of health. And so I think in the past, we thought of just being healthy or well as, I take this or I don't take this. I go to the doctor. I don't go to the doctor. But our communities, our food access, the quality of the food, the quality of the environment, that all plays into health. And so that's part of the discussions that we're having about how do we incorporate that into our lives, or how do you have conversations with people about what that's like for them?
Excellent. We have another caller. Let's take this caller. Good morning to you, caller. Thanks for calling.
Good morning. Thanks for your program.
Yes, thank you so much.
You speak on different aspects of health, including the run that you'd be having
Yes.
for exercise. But for some time now, I was thinking of combining. Why couldn't we combine? Like in communities, you have community gardens, so that would be exercise, and you plant herbs, and while people are working in the garden, they will discuss what's good for what and their health experiences. So maybe in each community, people who know more about health would take part. They could even bring their scraps from their kitchen for compost. So it would just be like a wellness garden, an activity.
Absolutely. So we, our mobile clinic actually had something called the Veggie RX program, and we partnered with community food banks. So people would come to get their food, but they would also come and they had a community garden. They would get different, planted vegetables and different things. And that natural gathering point was a place that we had a lot of discussions, or we would provide a lot of health services, because again, you're going to use your health services if it's where you are going to access it and what you're doing, from the start. So yeah, absolutely. Those things can be done. It's just, we have to kind of say, okay, how do we work together to get that done? And how do we have those conversations? So you mentioning that to Carlton, that's, part of it. I know you've done a ton of community events with exercise, with different
Public health education.
Yeah, it's all public health.
But one of the things that I've also noticed is that many of the new refurbishing of the hotels are now including a green spaces. I know that where you are, there are herbal gardens. I know at Intercontinental, I did see one there as well, where customers, their guests can actually go to the garden and select a herb and tell the cook or the chef, I would like to have this herbal tea done.
Yes.
So many of the hotels are now doing that, and many people in Dominica too are now planting their herbs at the backyard.
Yeah.
And making herbal gardens. I think where the issue may where more work needs to be done is understanding the herbs, what they're good for, the dosages, and passing the information from one generation to the other.
So we've done, I think for about 9 or 10 years, we've worked with Jungle Bay in Africa. Shout out to her and the spa. We developed kind of a tea tasting activity where we go through and we create our own bush teas and we talk about the different therapies. And we've been working on developing different components. They do herbal tours, and Pops, who is Sam's dad, he does a lot of discussions. He's been making our group teas every night to help with that. But I'm going to have Zach kind of talk a little bit about, I pulled up turmeric as an example for a resource that we have. And he's going to kind of tell you some of the things that we as pharmacists can see to kind of aid in some of those discussions. The database that I have up is NatMed, one of ours, but there are other ones that he'll kind of touch on that we can use to be a resource in that way.
Mm-hmm. Yeah, so just kind of speaking on that with passing information down, it's very important that pharmacists and doctors both know where to access this information and how to get good quality information to be able to talk to their patients about these different natural medicines. So some of the things we look for on these resources is the credibility of the resource that we're using, make sure the information is good and of good quality. We also look to see what all is in that natural medication, because even though most of them are herbals and natural medications, they do put some other things in there sometimes, like capsules and tablets kind of hold them together. Other things we look for is the effectiveness of them, the dosing of these medications, any interactions with other meds, some adverse effects that you might experience on these medications. We just kind of want to do a whole overview of all these medications and make sure that you're going to be completely safe with taking it and that it's actually going to do what it says it's going to do. So speaking on some of the other resources, there are some other free ones. The ones I am familiar with and use are Medline and Medscape, because I know you can't always access some of these resources, or it's behind a pretty big paywall. So it's important to know these free resources that are still of good quality. It's also very important to check with multiple different resources just to be able to make sure that the information is the same, and that you're not getting conflicting information from different sources that you're looking at.
Good, Zach. Let's take this caller. We have another caller. Let's see what this caller is saying. Good morning to you, caller. Thanks for calling.
Yes, good morning to you, Carlton,
Good morning to you, sir.
and your guest.
Thank you very much.
Let me tell you something about that medication stuff. You see, the herbs, my problem with the herbs, not that I don't believe in it, you know, but my problem is that you don't have a dose. You don't know what amount to take. You know, people will tell you boil 3 leaves. Boil 3 leaves or drop 3 leaves in what amount of water?
Yeah.
If you have to drink a glass, half a glass or a quarter glass, nobody tells you that. But
Yes.
they tell you it is good for this, it is good for that. I
Yes.
believe, that's why I believe in going to a doctor and I get my prescribed medication. I would use it better than the herbs.
Yes.
The thing is, you need to know the amount.
Mhm.
For instance, somebody say, what you call that, fireman good for prostrate and those things. But nobody tell you what amount to take. So you're going to overdose or you don't take it enough. It's on underdose or overdose. You know, so if you can get that, if people could get that together and the current dose for everything, I think we don't even need to go to buy the tablets and those.
Yes. And so
Thank you,
this
caller.
is a place where I know we've talked a lot about like going to somebody who is an expert in that and who really studies those things, who knows that. For me, I would always try to ask recipes here, and I really wanted to again help preserve that and write down the recipe. And it's a little bit sometimes like grandma's cooking, because it's actually, as is I think a lot of our medicines, it's titration, right? And what that means is, you know, you start with a lower amount and you work up your dose and you say, okay, is it working for me? Am I having potential side effects or potential problems? But working with an expert, then they can kind of have that conversation with you and say, okay, let's look at why this is happening. Is there something else going on?
Before we elaborate a little, let's just take this other caller. The calls are really coming in. Good morning to you, caller. Thanks for calling.
Good morning to you, Carlton.
Yes, good morning to you, ma'am.
And how are you?
I'm doing quite well.
And your guest.
They are doing quite well.
Thank you.
That's when I didn't believe I would really join in that conversation this morning. But what happened, I know it is not good to take herbal medicine with pharmaceutical medicine. Am I right?
In many cases, you are.
Right.
You just have to be careful. Alyssa's gonna kind of, I think she's signaling to us over here that she wants to jump in and kind of give you a little bit on that.
Hello, let me talk.
Okay, you go for
I
it.
am not doing it. Like if I know I'm hypertensive, I will take my blood pressure tablet from the pharmacy. And if anybody tell me, like when I was younger, it used to bother me a lot more. I take my medication. Sometimes I forget. I will get a headache and what. Somebody would tell me that bush is good for hypertension. I will not take it because I know already I'm taking the pharmaceutical medicine.
Yeah.
I just have to adjust it or do what I'm not doing, you know. But I am never in favor of taking those two things there together.
Good point.
And I've met people telling me that they are doing that. I tell them, yes, You can take your chances, but I will not take chances.
Mm-hmm.
I'm listening.
Thank you.
And it's important that we as pharmacists support you in that.
Yeah, I was just going to say, I think a lot of people have hesitancies to do that, just not knowing the interactions and stuff. And I think that is why it's really important to have those conversations with your healthcare providers. So if you do have friends or family that are taking those things, I know you said you don't want to, but I think that's where that risk benefit kind of discussions with your healthcare provider comes in, because there are some medications that are safe together. It's just really important that we know which pharmaceutical medications or synthetic medications you're taking and which herbal medications you're taking. And there are ways to, kind of get around any interactions, or we can adjust medications and things like that, but we do have to know that you're taking them. So I think a lot of people have hesitancies with that. And we were talking before about maybe lack of evidence for some of these herbal products. So I think that is a place of hesitancy for us as healthcare providers too, that we're used to seeing a lot of clinical evidence and seeing trials done for our pharmaceutical medications that we're using. And we don't have as robust trials for our herbal medications. So that is something that people are worried about. So that's just why it's really important to have these conversations. And the answer might be different for each person. So it might be okay. And some people are willing to take that risk if they feel very strongly about those herbal products. So that's why it's kind of an individualized decision for each patient.
Well said.
Yeah, and then just to add on to that, healthcare is just, like I said, integrated medicine. It's a combination approach. So just utilizing all the aspects of healthcare, and including lifestyle changes, like I mentioned earlier, exercise that will help with weight loss and cardiovascular effects on your heart to help with lowering your blood pressure, your heart rate. Eating a healthy diet full of vegetables, fruits, protein, reducing your sodium intake for your diet. And then, eliminating alcohol and smoking as well. These can all help with like your breathing and cardiovascular as well. So it's a comprehensive approach. We want to utilize all aspects of healthcare to provide wellness and health to the individual.
And whatever you do, you also have to really feel comfortable yourself. And you also have to feel informed, right? And again, like I know every time I talk to Carlton, I learn some different things that he knows a little bit more about. And then I try to share with him. But again, that ongoing dialogue, we get to what's right for you and what do we want to do. And Carlton and Jollies are amazing, amazing at doing that.
I also wanted to say too, because the caller called and spoke about dosages, but we've seen a transformation and the surgence of many herbal supplements on shelves with the right dosing. And so you now can see your ginkgo biloba tells you if you're that age, it tells you that age to that age, what the dose should be, how often it should be taken. And so what we're saying to you, if you have concerns with the portions that are sold maybe by the roadside or in stores, you have the bags of the herb and you're not too sure of trusting the label that tells you take 2 leaves or 3 leaves, you can simply look for the very same thing. So let us say you're buying, you might want to, let's say it's Sana, what we call in Dominica term, this is Seni. So let's say you're buying Seni leaves and you're not too confident with how much of the leaves you would put in the water. You can buy the Sana capsules or tablets, and it's already, the dosage is calculated and it will tell you if it's 1 capsule or 2 capsule. So you can look if let us say it's a preparation that you want to take, you can find out if it's in capsule form or tablet form or liquid form in the pharmacy, and you can purchase it in that format rather than the actual herb that you may not know how to measure. So I'm just wanted to highlight that because we do have a very, very wide variety of herbal supplements that's on the shelf that are already dosage calculated. Let's take this caller before. Good morning to you, caller. Thanks for calling.
Yes, my brother, Mr. Jolly. What's up, Mr.
Good
Jolly?
morning
What's
to
up?
you. How are you doing today?
Well, I'm listening and I'm just here cool and connected. Very good program as
Thank you.
usual.
Thank you.
And you have the right set of people to get us connected.
Yes.
We were talking about dosage a while ago, and that's my problem with some of the herbs that they decide to make us take. And some of the people in itself that is selling the herb. That's the only problem I have with the herb. Because you see, medication, certain medication is just like alcohol. Some people can drink whiskey mixed up with a brandy. Drink a whiskey and drink a brandy. Nothing will be wrong with them, but they have the little hide, the little thing and control it. It's just like certain people will take the tablets in itself and still go for the herbs in itself and you find nothing. But some, before they try it, they might end up in the hospital.
Sure.
You understand? That is the problem. But my main problem about the herbs is the people.
So we're talking about the
people that they have
competencies
on
of the
side
people.
of the road and those kind of things. That they cannot even advise you to tell you if it's half a spoon or if it's a whole
Their
big spoon or
competencies.
what.
Yes, yes.
But they have the job. Well, that is it. That's good for your bone. It's good for
Yes,
this and that.
yes.
But Mr. Carlton, I appreciate what you're doing. That's why I tell you, you can still work for Mr. Jolly and still open your little business on the side. Remember I always tell you that.
You always
Happy
do.
New Year
Thank
to
you
the
so
whole
much
team.
to you.
I wish you more strength,
Thank
more
you.
life, and keep on helping the elderly.
I appreciate that.
All right.
We have another call. I think the calls are just really coming in today. Good morning to you, caller. Thanks for calling.
Good morning, Carlton,
Good morning to you.
and good morning to your guests.
Yes, good
Let
morning.
me say welcome to them. Looks like some of them are together Dominica passport just now. They've been here so often. Yeah, Carlton, I'm a herbal person, and I've been using herbs for many years. I rather take the herbs than I take conventional medication. I drink herbal tea every evening, but I usually do a cocktail. In the old days, they would tell you drink X, Y, Z herbs. As you know, we have a lot of herbs, in Dominica, and a lot of them are taken for different reasons, but without a dosage. What I've tried to perfect is I take like a little heap, like a half a leaf of about 4 or 5 different herbs, and I do a cocktail. I put in a cup of water. I pour hot water on it. I always draw it. I never boil it. I don't put any sugar in it, and I use it for a cleanser, not for nothing particular because I'm fairly healthy. And I take that every night because I'm aware of if it's too strong, you might overdose, or I might overdose myself. I try to perfect it. So as I said, I put half a leaf in the water and I drink it while it's warm. What I found out is, let us say I would forget and go to the toilet or something and come back. Once it gets cold or once the leaves are in there for too long, it becomes bitter, and then I don't take it again. So I perfect that. So once it's warm, once any of it is left there, in my opinion, it's an overdose. I don't take it anymore. And also following that, overnight I put a clove of garlic, a piece of aloes in a glass of water, and I drink that first thing in the morning. And that is basically every day. Um, would, in your opinion, and would the pharmacists, in their opinion, would you think I'm taking too much of that? Um, uh, um, well, we have spoken about the overdose. I read about the dosage. I don't think there's any amount of leaves you can save dosage. But as I said, I'm happy with what I'm doing. I've been doing it for many years. What I would like to find out is whether taking that most nights and then taking the garlic and aloes first thing in the morning, a glass of that, whether it's okay, whether I'm overdosing myself or whether I'm doing any harm to myself. As far as I'm concerned, I've been doing that for many years, and I'm great. I'm feeling okay with that. So I'd just like your opinion on that, and and share that part of it as overdosing or not overdosing. A little leaf, a little bit. You take it while it's warm, draw it, which when I say draw, just I put in hot water and
Okay,
leave,
caller.
no
Thank
sugar.
you. Thank you.
And,
So we're going to get a response.
all right,
Thank you.
okay,
Thank you.
Hi, thank you so much for sharing your experience. I think it's really good to hear, that you've been trying these things by yourself and kind of learning based on your own body what's good for you, what's not good for you. From your experience, it sounds like you've been using it for several years without knowing any other of your other health conditions or your other medications. It's kind of hard to tell right now, whether it's too much or whether it's the right amount for you. But that's definitely a great conversation to have either with your doctor or with Jolly's Pharmacy. If you could walk in one day and just kind of bring up to them what's going on, why you're doing these things. But I appreciate that you shared your experience, because I think that when we think about why people use herbals and supplements and these different techniques for their health, it's really important to consider why these people are doing it. We've had callers saying that they are not using herbals. And then, of course, we have other callers saying that this is something that's a staple for them. So just kind of learning as pharmacists and especially as students about why our patients are doing these things. It sounds like for you, it might just be something that you've been doing for maybe all your life and is something kind of ingrained into you. And if you're feeling good, that's great. There could be other options why patients are using these different therapies as well, whether it's because they've had poor experiences with our more synthetic prescription drugs, whether that be lack of efficacy or some side effects that they're experiencing, or just because they're really looking for more impact on their own healthcare and wanting to use more natural substances. So thank you for sharing your experience and would love to hear more about it, whether you come to Jolly's or just want to talk to your doctor about it.
All right. We have to start wrapping up. We are a little above time already.
That's
Time runs very
good.
quickly.
It went fast, Carlton. Always a good time being able to talk to you.
Yes. Yes.
Talk with the callers.
Definitely. So, yes, we had a very informative. We really can't. The calls are still coming in. We really can't take any more call because we're supposed to be here cut off at 11:30. It's 11. It's just about 11. Well, this looks a little fast. So I suspect I have a few more
Mine
minutes.
says,
All right. So let's take this caller. Yes. Good morning to you, caller. Thanks for calling.
Yeah, Carlton, quickly, it must be stressed that, herbal medicine is not always safe. Like every other medicine, it can be dangerous and people have to be careful. Thank you.
Thank you. Let's take this other caller. Good morning to you, caller. Thanks for calling. Good morning, caller.
Hey, morning.
Good morning to you, sir.
Yes, morning, Mr. Carlton.
Good morning to you, sir.
And morning to your guest.
Yes.
Carlton, you raised an excellent point about the blood thinner, the ginger, and
The turmeric.
turmeric.
Yeah, ginkgo.
It's a blood thinner. But sometimes when you get a stroke and you go to the hospital, they give you certain
Blood thinners, yes.
medicine for blood thinning. And what you find happen, the patient might get a stroke and they might say they have a blood clot, but then they take too much and they have a constant bleeding from the medicine. So it's a balance. And your first caller raised a topic about the green guy from the States. He raised excellent ideas. And then the lady who called and talk about the gardening and go to the different communities. This is something very excellent, Carlton.
Yes.
And I think we should go further and continue educating the people about the natural medicine, because you have two sets of people in the world. You have those that want the doctor medicine and have those that want the herbal medicine.
That's true.
Carlton, you have a very good program, and the herbal medicine is very big demand now.
Yes, we've noticed that. Thank you, caller.
Thank you.
Thank you. Let's take this other caller. The lines are really going this morning. Let's take this other caller. Good morning to you, caller. Thanks for calling.
Good morning, Carlton.
Good morning to you, my dear. Thank you. Thank you so much. Thank you. Good morning.
You're welcome. Carlton, a lot of us in our age that we should know about a lot about herbal medicine. But because in growing up, I would see our grandmother, our mother would tell us when we're going to make a herbal tea, use 2 leaves, use 3 leaves, and to dry it. When I wanted to know more about because herbal medicines, thing I like. When I wanted to know more about herbal medicine, I bought herbal books to teach me on how to use my herbs. And then certain part of the books will show you purple that will tell you it's not good for this and it's not good for that. You shouldn't take it internally, what to take externally. That is what I learned from my herbal books. So I love herbal medication very, very much, and I depend on that. If I come by you for something and I try it, at the back of my mind, They're going to get me sick. And maybe because of the phobia by getting sick, I'll feel, no, that wouldn't do me good. So I love my herbal medicine. And medicine is a good thing because that's what our great-grandparents grew up on. And they knew how to take it. We just have to learn how to take our herbal medication. Bye-bye.
Thank you very much. Thank you, caller. And
Carlton,
yes.
I was thinking about this, and I mean, I think a lot of us are saying again, it is a balance. It's a personal choice. It's benefits to risks. It's considering where we find that information and where we can find more. I know you guys will have access to NatMed
Definitely.
that we have, and it kind of gives us a scale of benefit to risk for most conditions. And for pharmacists, we're considering factors that you have that raise or lower that risk specific to you. So, you know, it's not that you can't take both. You can't do both. You can't do one. You can't do the other. But again, it's just working. We should be in a partnership to find that right balance together and to make sure that those benefits are more than those risks for our patients.
Definitely. And so we are wrapping up. I'm going to give the team just a few seconds, each of them to just say maybe something that they want to leave with you as we wrap up. We can start with Zach. If you just want to leave something with the listeners who listen today, maybe just something, an advice or whatever it is.
Yeah, I mean, I talked a lot about integrative medicine, and it's something to consider. You know, having that open conversation with all your healthcare providers, whether it's your pharmacist, your primary care physician, chiropractor, acupuncture, yoga. I mean, there's so many forms of integrative medicine, and it really helps the whole entire body, your mind, soul, mental wellness, and physical wellness. So just keep that in mind. Have that open communication with your healthcare providers, and definitely, if you have any questions, go to Jolly's Pharmacy.
Thank you.
Zach number 2.
First, I just want to say thank you guys for listening and those who called in. It was really nice hearing from you. I know I kind of talked about the resources for pharmacists and doctors to look at to kind of make sure everything's okay, but it's also kind of important. You on your own, you can go to these resources, do your own digging of information. One really good one is Memorial Sloan Kettering About Herbs section is a really good resource that you can look at on your own to make you more informed when you go to have these conversations with your pharmacist at Jolly's Pharmacy.
Awesome.
Yeah, and I also want to thank everyone, but I guess my final point is herbal medications are used worldwide and in like around 170 countries, and 80% of the population feels trust in these herbal medications. And not only they could be used for multiple things, including preventative care as well. And just wanted to let everybody know that, like Dr. Abrams said, it could be you can have it for preventative by itself or in conjunction with other types of medications as well.
Great.
Thank you all so much for calling in and listening today. It's been a pleasure to be on Q95 today. Just want to advise you guys that if any of your loved ones, any friends are not listening to us currently, to go out and share this information with them. You never know what that might spark for them, and hopefully it increases the health of all of your loved ones.
Yeah, I just wanted to say also thank you so much for having us. And I will end with, as pharmacists, we really want to help our patients. So we hope to build relationships where you feel comfortable discussing all this with us. And then we will ask those questions and be a listener to provide the support that you need.
Awesome.
Yeah, thank you everybody so much for calling in and listening. I just wanted to end with, it sounds like we had some different opinions from different callers. So the use of these herbal medications is really an individual decision. So if you're not comfortable with it, or if you really believe in these herbal products, you just have to weigh the benefits and risks for yourself. And if others don't believe in that, then that's okay. So you have to do what's best for you.
Awesome. Dr. Ambrose.
Again, I just want to say thank you so much to the people of Dominica for teaching us so much about this. I know that I've been on my own personal journey to learn more about culturally appropriate care, linguistically appropriate care, to learn about balanced life. And every time I come here, I learn more from all of you. And having friendships like the one with Carlton, like the one with, Cassandra, with the Ministry of Health, with Jungle Bay, like all of those make it possible to learn more and for me to share my opinion too. So I like having that dialogue and discussion, and I hope you have those discussions, just as Sydney said, with other people. Continue on, and we'll get to a better place together.
Definitely. So we really want to thank you for really listening again, as usual, to our episode this morning as we focused on herbal medicines and their relevance. But we also looked at some of the concerns that should be highlighted when embarking on the use of any preparation of herbal supplements. As always, your health is indeed your greatest resource. Preserve it. Have a good morning, everybody, and remainder of the week. Take care and goodbye. Bye-bye.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango, with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Oh, and if they say convenience could make a big difference, then you can trust me. I know just where you should be. That is JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun with your brother or with your son. We get that to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun. Bring Papa and Mama along. We get that to everyone. What a happy place. Oh, what a happy place. But just stick some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Funkole, where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
I woke up this morning feeling real stink. I had temptations to call it sick, but I end up in Jolly's Pharmacy. And down in the street, and it's fix up my immune system. Me feeling fit and strong now, I'm ready to work and make on any mission. If you see me again, Jolly's Pharmacy is number one. Jolly's again. We cater for everyone. Jolly's again. Boost up your immune system. Jolly's again. Yeah.
My dear. Oi, mama, oi. Somebody, yeah. Mama, yo. Oh, Mr. PM, I'm inviting you to take on your biggest challenge. Sing a calypso. I hear them say you are the world boss. You conquer everything you touch. The way you handle your opponent, nobody can contend. You are a two-time doctor, big-time.
The romance begins from the very first sip. Treasure the rare, inviting richness found in our light wooden notes with a hint of vanilla. This rum is aged in individually selected oak bourbon barrels to guarantee a superb mellow taste with notes of dried tropical fruits, exhilarating the palate. Our unique aging process unlocks sweet, oaky notes with aromas of chocolate, toffee, and dried fruits. Angus through a single barrel rum, distributed by Fine Foods Inc.
Did you know that at Burton and Company, we provide electrical wiring and evaluations? Our certified electricians offer quality services paired with affordable rates. Give us a call at 448-2815 or follow us on Facebook and Instagram for all in-store promotions.
Hi, children. This one is just for you.
It is the ECCB Children's Connection Program coming your way on this station. Come, listen.
Join me, Auntie Marcia, and my co-host,
Quentin Tong and Ramalia Thomas and other children just like us, ages 5 to 12. Listen and participate in exciting stories, powerful lessons, smart quizzes, wise words, and win prizes. Awesome!
ECCB Children's Connection Program, every second Sunday of the month at 1 p.m. on this station. Don't you miss it.
Sponsored by the Eastern Caribbean Central Bank.
Auto Trade introduces Thrifty Thursdays. On the last Thursday of every month, get up to 20% discount of various items in the store between 9 a.m. and 11 a.m. But wait, there's more. Also, look out for what Tina today offer for an even bigger discount. You can't miss out on this retail savings. So come to Auto Trade on Thrifty Thursday. At Auto Trade, it's more than a vehicle. It's a relationship. Terms and conditions apply.
Steamy Store in 2024. Be seen wearing the best and latest styles in eyewear from Quartz Optical. Buy one frame and get a second pair for free. Mix and match with your favorite brands. A variety of colors and fresh new styles. Buy one frame and get a second pair absolutely free. Shop today with no cash and pay later. Schedule your free eye exam today at quartzoptical.com. Soar into 2024 with BOGO. Only at Quartz Optical. Value you can see. Conditions apply. Offer valid until January 31st, 2024. See in-store for details.
Wake up! Wake up! It's time for J'ouvert!
Mass! La we play Old Mass! Old Mass Festival is on for Carnival 2024. All Stenstays, Moko Jumpy, Suswell Subi, Big Bottom Ladies, Black Devils and more. Head to Old Mass Festival. Saturday, January 13, 2024 in Pointe Michel from 4 a.m. The